Hi, this is Dr. Duff Sprawls at the Space Coast Cancer Center. I'm here to continue talking to you about preventing nausea or vomiting from chemotherapy with medications. These anti-nausea medications are very important and are the key to preventing you from getting sick from your chemotherapy. There are some people who still develop nausea even with benzodiazepines like Ativan and Zofran or Aloxi, and they invented new medicines about 10 years ago. This one's called Emend. Emend comes as 3 pills. The Emend tri-pack is 1 pill before chemotherapy and then 1 pill on the second and third day afterwards. This medicine, when added to the others, ensures people to not get sick to their stomach from even the strongest chemotherapy. The final category of chemotherapy drugs that we commonly use is called steroids. You might have heard of steroids before. We're not talking about the stuff that you get on the cover of Muscle and Fitness magazine. We're talking about the medicines called glucocorticoids. And you might be familiar with them. For example, hydrocortisone. You can even buy this over the counter as a cream. Hydrocortisone, prednisone, and the big daddy, dexamethasone, can all be used, but we mostly use dexamethasone because it's so potent and long-lasting. People will be given dexamethasone either orally or intravenously before and after their chemotherapy. Sometimes people take it for up to 5 days afterwards. The main concern about dexamethasone is it can raise your blood sugar, your blood pressure, give you insomnia, and make you feel very energetic. Actually, the last one's not a problem. But dexamethasone is something you will probably have a prescription for. There is a 5th category of anti-nausea medicines for delayed nausea and vomiting or for failures of antiemetic therapy. These medicines have been around for many years and they're mostly related to antihistamines and antipsychotic medications. These have been invented 25 to 50 years ago, and we use them commonly. Now, as I've mentioned before, Zofran is the first one that we reach for, but if that's not effective, we often use compazine. Compazine exists as a pill, suppository, or injection, and it's still quite effective in this situation. One of its cousins, called Phenergan, can also be used, although it has sedating side effects. It's not my favorite. After that, we have other anti-nausea medicines, including Haldol. It's quite effective given as pill or as injection. And there's other anti-nausea medicines that we could prescribe, but this needs to be discussed with your physician. If you have failure of primary anti-nausea therapy, contact your physician or nurse right away. We do have other medicines that will help alleviate your symptoms.